executive for plastic surgery, Bloomfield Hills, Michigan. And so another nice, interesting Facebook Live. This is a nice 50-year-old patient. Comes in with a set of implants, the one and only what are saline implants. Back in the day, 2001, you could only get the saline implant unless you were part of a study. And so she had a lot of symptoms of breast implant illness, hence her desire for what is removal of the implants. They were certainly past time, and she had many, many symptoms. So here's the 100% total capsulectomy, 11/20/25, initials EHM. And as you will see, there was a lot of contouring that was done given her presentation. She had stated that her implants were above the muscle, and lo and behold, as you can see, below the muscle is where the implants were. So a lot of tissue that I removed that was inflamed and angry, and as you can see, as I cut through, this is all the scar tissue that's present. So I'm going to go ahead and cut through what is a lot of, now we know with saline implants, when they do rupture completely, i.e. like a water balloon majority of the times, 99.9% of the times. So as you can see, this is a lot of weepiness, inflammation that's present around this saline textured implant. And this is the reason behind a lot of inflammation present. So if I go like this around, look at this. If I were to show you this, you would probably say this is a ruptured silicone implant, but this is that very slimy leaching of this silicone, and this goes to showing you. One day, I'm in the process of talking to a professor where I'm going to one day send this off for analysis, and we'll know exactly what it is. And this is that leaching of that silicone from the silicone shell of the saline implant. Very slimy, and not enough to send to cytology. So this is your 300 McGann, just like the patient stated, 300 cc's, what appears to be overfilled. Now this is that capsular tissue. You can see in it what are these spots, not uncommon to see. Not only the implant capsule has been removed, the implant plus a capsule, but if I cut this open, you will see there's a lot of inflammation around behind this capsule that I have had to remove, including this fatty tissue. And so this is also important because that is part of the culprit in my practice. I remove, so this yellow fatty tissue I've had to remove as well. And that is the peace of mind, confidence that all of this leaching, not only the capsule but surrounding tissue, has been removed. And I'm very happy and content with how the whole dissection has gone. So now I'm going to go ahead and remove my top sterile glove, and I have another sterile glove underneath. Left side, a lot of contouring. This is some tissue that I removed right on top of the rib, in addition to the amount of inflamed tissue that was present. So I'm very happy and content with how the whole dissection has gone. And again, this tissue is, in my eyes, in my palpation, bad. I'm going to cut right to it so you can see. This is all that scar tissue, inflamed tissue. So as I go in, again, a very, very weepy looking implant. And again, look at all that fluid around it. Very slippery. This is 300 McGann as well. So I'm going to go ahead and remove this just to be complete. I'm going to send this off with the capsular tissue. Obviously we have a good representative sample on the inside. A lot of inflammation. Look at this, how thin this capsular tissue is right here. You can see my glove, and all of this, we will get a lot of detail from the pathologist in regards to what exactly this is and what this is not. And I'm going to send this off. So this goes to showing you, look at this. Everything inflamed, bad, irritated, looks abnormal, feels abnormal, overfilled, implant plus capsule plus inflamed tissue removed completely, definitively. A lot of significant contouring done. If you factor in the amount of tissue that I removed, plus the capsule, that's almost or more than the volume of the implant. And we're going to see aesthetically, she's going to look very sound. She's got a lot of breast tissue remaining, plus, her BMI that certainly will allow for her aesthetics looks to be very well achieved. So the implants will be returned to the patient, capsules to be sent to pathology, rule out that rare BIAL, CLCD for the analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal. And then most importantly, we'll see how the patient does post-op minus these toxins. This is Dr. Khan, Executive Plastic Surgery.